So I want to talk about the aftercare. We know most women who do have postpartum hemorrhage maybe might not die as a result of the postpartum hemorrhage at that point in time. They die after the care. So it is very crucial that healthcare workers do follow up on these patients, especially for regular vital monitoring, including respiratory rate, because it is evident that most nurses in the maternity department, even not only maternity department, in other wards, they normally forget taking respiratory rate of the patient. So it is very important. Yeah. So you also need to know the fluid inputs and outputs through the charts, and then we can escalate our concerns to the necessary people that need to know, and then we'll confirm whether antibiotics are needed for this patient, and then we can also think about what has remained in the abdomen or in the uterus, whether how many gauze are being placed to pack the uterus. And then also we need to consider giving anticoagulant drug like enoxaparin or Clexane, especially for those who have undergone surgery to prevent thrombosis. And then we give adequate analgesia because they are in pain, and pain can also restrict them from movement, which can also cause another complication. We need to explain to the family and other relatives around, and then maybe we consider for appropriate site for care. Example, for higher facilities like the district hospitals or regional hospitals. So the long-term complications for postpartum hemorrhage is that most of these women who has had especially major obstetric hemorrhages above 2,000 mils are at risk of serious complications, which include sepsis, DVT, or pulmonary embolism. They can also have postnatal depression. They can also have breastfeeding problems, and they have what we call a rare syndrome that we call Sheehan syndrome, where again there will be poor urine output as a result of cortical necrosis of the kidney that can stop producing a lot or enough urine. In a nutshell, the management of postpartum hemorrhage is just dependent on the cause. So for all causes of postpartum hemorrhage as a result of a tonic uterus, we can just give uterotonic drugs, for example, oxytocin. We can give misoprostol. We can give carbetocin in order to control the uterus. If it is as a result of trauma, in example, cervical tear, perineal tear, vaginal tear, uterine rupture, you can also manage accordingly. If it is tear, you can repair the tear. If it is rupture, you can do laparotomy and maybe repair the uterus, or maybe you go on with hysterectomy. And if it is as a result of tissue, you can remove the tissues that have retained. And then if it is thrombin, which is very rare, you can also give anticoagulant. You can give drugs that can cause clotting, and also maybe you go on with surgical intervention, which is very difficult because they can die as a result of continual bleeding. So we treat them according to the cause of the postpartum hemorrhage. So far, I think this is where I can stop for postpartum hemorrhage. If there is any questions, you can ask, and then you can drop your comment also on the TikTok page or my phone number. Thank you very much. I appreciate your time you took to listen to this video. Bye bye. I will talk about another topic maybe tomorrow. Yeah, thanks.